More than 70% of Clark County has at least one vaccine, but some groups are falling behind.
Fox 5's Jacqueline Schultz is here now to break down the challenge to reach minority communities.
Yeah, that's been a problem across the country. So even if you have clinics in neighborhoods, it's been a challenge to reach some ethnic groups more than others to get the vaccine. A study from Bloomberg shows Nevada had one of the fifth lowest vaccination rates among all 50 states for Black Americans. Here's a snapshot from Clark County. The latest numbers: white residents, at least one vaccine, 42%. Hispanic residents, 52%. Asian residents, 62%. Native Americans, 48%. African Americans, almost 38%, the lowest out of all the groups. The health district says not everyone discloses their status, so the numbers might not be entirely accurate, but they acknowledge they want to help improve these numbers.
It's disappointing, but it's not shocking. We're certainly seeing that the vaccine rates are lower than we would want, particularly amongst communities of color. And some of the hesitation actually has to do with some of our long-standing history of disparities when it comes to medicine, our poor outreach to many communities of color historically, and true mistrust as it relates to the science behind the vaccine.
Dr. Cindy Dukes, a virologist and fertility doctor. She says vaccine hesitancy is certainly a challenge in communities of color and those who are pregnant. The CDC does recommend vaccines for pregnant mothers because of the risks of COVID, which range from miscarriage to early delivery. She says a crucial mission for healthcare experts is to continue to go into communities and help educate people.
Let's answer the questions. Let's not make assumptions that they're simply anti-vax. Many of them are truly hesitant because the information isn't clear and they're not sure which sources are trustworthy when it comes to their communities.
The Health District Chief Medical Officer, Dr. Fermin Ligan, tells me in an interview today the work is not over to reach Black communities across the valley and improve these rates. They are planning more meetings with community leaders and representatives, all to help them spread the message of the importance of the vaccine and testing. John.